Morning, Mr. Blue. How are you?
I'm fine, and you?
I'm fine. My name is Tulele Masango. I'm a third-year nursing student, and today I'll be here to assess you. Is that fine?
Yeah, it's fine.
Okay. So, Mr. Blue, you came in here with a cough. You have been coughing for the past 3 days, right?
Yes.
Okay. So I want to know, when you cough, do you have any chest pain?
No, I don't.
You don't have any chest pain?
Yes.
Okay. I also want to know, do you sometimes maybe faint or feel dizzy?
No.
You don't feel dizzy?
Yes.
All right. What about when you are sleeping at night? Do you sometimes feel that you don't have enough breath?
No.
No. What about when you are laying down, maybe during the day, you are watching TV, you are laying down on the sofa? Do you feel that you have difficulty in breathing?
No.
Okay. So do you have any difficulty in breathing when you take a walk?
No, I don't.
What about when you exercise?
Yeah, I do.
Sometimes.
Yes.
Okay. And then do you sometimes feel like your heart is beating too much to a point that you see that this is not normal?
Yes.
Okay. And then do you sometimes feel tired although you haven't done much work?
No.
You don't?
Yes.
Okay. And then do you have any swelling on your legs?
No.
You never had any swellings on your legs?
Yes.
Okay. And then now I'm going to ask you about your medical history and the medical history of your family. Do you have high blood pressure?
No.
Okay. And then does anyone in the family has high blood pressure?
Yes.
Okay. And then do they take medication for it?
Yes, I do.
Okay. Do you have any heart disease?
No.
No heart disease. Does anyone in the family have any heart disease?
No.
Okay. And then do you have diabetes mellitus?
No.
So do you use any medication?
No.
Okay. And then have you had any operations, like where they cut you?
No.
No. Okay. And then do you drink alcohol?
No, I don't.
Okay. Do you smoke?
No.
Okay. Do you use any drugs?
No.
Okay. And then what do you do for physical activity?
I walk.
You walk. Okay. And then how do you manage your stress?
I walk.
You also walk. Okay. Um, and then how is your diet? Would you say that you are eating healthy foods, or you are always buying takeaways?
I'm eating healthy food.
You are eating healthy food. Okay. Top. Mr. Blue, can you please take off your shirt for me? Thank you. Okay. With inspection, inspect for any scars and bruises on the chest, for asymmetry, and also for any discoloration. Also assess the jugular venous pressure on both sides. Ask the patient to turn to the left and also ask the patient to turn to the right. Can you please just lift your chin up? So now I'm going to palpate the trachea to check for any tracheal deviation. Can I please see your hands? So now the patient is showing me his hands so that I can assess for any signs of cyanosis and any signs of clubbing. Thank you. Right. So let me just feel you for your pulse next. It is always important that you palpate the different pulses. So I started with the radial pulse and I moved on to the ulnar pulse. Now I'm going to palpate the brachial pulse. Moving on to the carotid pulse on both sides. It is always important that when you palpate the pulses that you compare the two sides, and also when you palpate the pulse you have to measure the pulse as to how many beats per minute. Okay. Now I'm moving on to the
Please lift up
popliteal
your
pulse.
leg for
So
me.
you ask the patient to
Like this.
just lift
Yeah.
up his leg a bit, and then you palpate the pulse behind the knee
Alright. The
on
other one.
both sides. And also move on to the posterior tibial
Just lift
pulse
this
as
one up
well
a bit.
on both sides.
Okay. Stop.
Palpation and auscultation. So here I'm going to palpate the trachea once more, and also I am going to locate the landmarks of the heart sounds. As you can see here, I am moving through the ribs to locate the second intercostal space on the right hand side, where I'm going to find my aortic valve, and also on the left hand side I'm going to find my pulmonary valve, as you can see there. And then on the third intercostal space I'm going to find my Erb's point. On the fourth intercostal space, I am going to find my tricuspid area. And then on the mid-clavicular line right there, I am going to find my mitral valve. So as I auscultate on the aortic valve, moving on to the pulmonary valve, moving on to the Erb's point, where I'm going to hear my S1 and S2 sound, moving on to the tricuspid valve, and then lastly, the mitral valve.
Okay. Thank you, Mr. Blue.
After assessing Mr. Blue for the cardiovascular system, I found that his vital data is within the normal ranges for his age. Although during the assessment, there were no signs of any heart disease or cardiovascular impairments, Mr. Blue didn't have any signs of cyanosis, clubbing. He says that he has never been diagnosed with hypertension, and he's also on a healthy diet.